Welcome to SSR Pharma Media, your trusted source for pharma knowledge. Pharmaceutical Inorganic Chemistry MCQ series, your exam power boost. Today we are going to discuss about dental products, prepare, practice, succeed. So under the dental products, we are going to discuss about dentifrice. So dentifrice is example tooth powder and toothpaste, and we will see the definitions of dentifrice. So dentifrice means it is the preparation used with a toothbrush to clean, polish teeth and maintain oral hygiene. So it is called dentifrice. And functions of the dentifrices are remove dental plaques and debris, prevent dental caries, improve breath, maintain tooth enamels. So these are all the functions of dentifrice. And category of dentifrice, that means in the tooth powder and toothpaste preparations. So these are all the important compounds present. First is abrasive. So abrasive example, calcium carbonate, dicalcium phosphate. So for cleaning and polishing teeth, it is act as a abrasive. And humectant, so it is present in the toothpaste, like example glycerin and sorbitol. So that this will prevent the dryness of the toothpaste. It acts as a moisturizer in the toothpaste, prevent the drying of the toothpaste. Next is a detergent. Detergent example is sodium lauryl sulfate. So it is produce the foam. For proper cleaning, produce the foam. It acts as a foaming agent. And sweetener, so example sodium, saccharine sodium. So while we are brushing, it produces the sweet taste. And finally flavoring agent, so peppermint oil produce flavors in the toothpaste. And finally therapeutic agent, fluorides. So fluoride is act as a therapeutic agent, which means it's to prevent the dental caries. The primary purpose of dentifrice is to, so option B, clean and polish teeth to maintain the oral hygiene. Which of the following not a function of dentifrice? So option D, treatment of periodontal abscesses. So remaining three are, it is the functions of dentifrice. So except treatment of periodontal abscess. Which of the following substances is commonly used as an abrasive in dentifrice? So option C, calcium carbonate. So calcium carbonate and dicalcium phosphate is act as a abrasive. So that is a mechanical cleaning of teeth. It is used as a mechanical cleaning of teeth. Which ingredient is added to dentifrice mainly for the prevention of dental caries? So option C, fluorides. So fluorides is used to prevent the dental caries. That means tooth decay. Sodium lauryl sulfate present in dentifrice act as, so option C, detergent. So detergent is act as a detergent, so also called a surfactant, that helps in foaming and dispersion of debris. So next is in this dental product, we are going to see about the role of fluorides in dental caries. So what is the mechanism of action of fluorides? So first is the convert hydroxyapatite into fluoroapatite. That means more acid resistant. Then this fluorides first is convert the hydroxyapatite into fluoroapatite, inhibit the bacterial metabolisms and enhances the remineralization. So benefit is prevent the enamel demineralization, reduce acid production by bacteria, strengthen tooth structure. So these are the main benefits of the fluoride. And commonly used fluoride compounds are sodium fluoride, stannous fluoride, and sodium monofluorophosphate. So mainly this sodium fluoride is used in the toothpaste and mouthwash. Stannous fluorides anti-caries and anti-gingivitis, and sodium monofluorophosphate is the dentifrice. So adverse effect, dental fluorosis may occur. This means excess of fluoride. So while the fluoride, when we are using the fluoride, so before going to see the role of fluoride, we must know about the how we are getting the tooth decay. That means dental caries. So while in the night after taking food without washing our mouth, we used to sleep. So we'll close our mouth and while sleeping. So inside the oral cavity, it was dark. So in the dark conditions, the microbes will come out from the between the teeth and eat the food present between the teeth. Food particles, if we are not brushing our teeth in the night, the food particles may left between the teeth. So that food particles eaten by the bacteria, and it produces the bacterial fermentations. So bacterial fermentation takes place. So during that fermentations, it produces the acid. So that acids makes the decalcification of the teeth. That means demineralization or decalcification of the enamel or the teeth takes place. So due to that decalcification, the lesions may form. So through that lesions, the teeth, through that lesions, bacteria will enter and will get the tooth decay. So this like this only the dental caries takes place. So when we are using the fluorides containing paste, so this fluorides uh, may may spread on the surface of the teeth, and it is prevent the acid decalcification. That means enamel demineralization get prevented by the fluoride. So above the teeth, on the surface of the teeth, the fluoride may present, it is form the smear layer on the teeth. So that's why our teeth looks like a slightly yellowish color due to the presenting the fluorides. So this fluorides preventing our teeth from the tooth decay. So when excess in these fluorides mainly we used to take naturally through the water. So in some area of the water, groundwater may containing excess fluorides. So when we are taking excess fluorides, in that case, in our teeth, the uneven distribution of colors may take place. So some of the areas a dark color like a stains, it may looks in the front of the teeth. So that is called dental fluorosis. So uneven distribution of the color of the teeth is called dental fluorosis. So these are all the example of the compound. It is used to prevent the tooth decay. The anti-caries action of fluoride is mainly due to its ability to, so option B, convert hydroxyapatite into fluoroapatite. Which of the following effects of fluorides contributes to the reduction of acid production in dental plaques? So option B, inhibit the bacterial metabolisms. That means inhibit bacterial metabolisms or inhibit bacterial fermentations. Due to the bacterial metabolisms, it produces the food particles get fermented and it produces the acid. Production of acid takes place. So that production of acids will affect the teeth. That means demineralization of enamels takes place. So that we will get tooth decay. Which fluoride compound is commonly used in dentifrice? Option C, sodium monofluorophosphate. So next is the desensitizing agent. The agent used to relieve dental hypersensitivity or dentinal hypersensitivity. So when we used to drink a hot coffee or cool drinks, so when we are having, so during that time our teeth may get sensitized, that palkucham. So that is called hypersensitivity. So in order to prevent that sensitivity, so these are all the compounds included in the toothpaste, like strontium chloride, zinc chloride and strontium acetate. So these are all the compounds act as a desensitizing agent. It's act by local anesthetic. It's act as a local anesthetic. So when we are using this paste, our teeth get locally desensitized and we will not feel any sensitivity. These are all the compounds. And synonym of this compounds, you read it. Mechanism of this compounds mainly act as a local anesthetic and also occludes dentinal tubules and reduces the fluid movements and decreases the nerve sensitivity. And zinc chloride is protein precipitation and seal dentinal tubules. And strontium acetate forms insoluble complexes with dentinal tubules. So this is a mechanical use. It's a reduce the hypersensitivity, it acts as a desensitizer, it reduce the hypersensitivity. So it is commonly used in these dental preparations. Which agents act as a dentin desensitizer by protein precipitation? So option C, zinc chlorides. Which desensitizing agent reduces dentinal hypersensitivity mainly by occluding dentinal tubules? So option C, strontium chloride. Strontium acetate is primarily used in desensitizing toothpaste because it, so option C, form insoluble complexes within dentinal tubules. Which of the following agent formulations combination is correct? So option C, strontium chloride, it is used in the toothpaste or tooth gel. So next is the denture adhesive. So denture as adhesive is nothing but, so it is a type of gum or stabilizers is used in the dental preparation. So the agent used to improve retention and stability of the dentures. Mechanism: swell in saliva and increases adhesion and reduce food particle infiltrations. So like powder form, it is available powder form, creams and pads. And types of the compounds: natural polymers, synthetic polymers. So these are all the examples of natural and synthetic polymers. The primary mechanism by which denture adhesive improve denture retention is by, so option B, swelling in saliva to increases adhesion. Which of the following polymer is a synthetic denture adhesive? So option C, sodium carboxymethyl cellulose. Which of the following is a commonly used natural polymer in denture adhesives? So option C, tragagant. So next is a dental product, mouthwash. So mouthwash is a liquid preparations used to cleanse oral cavity and reduce oral microorganisms. Its main function is antiseptic action and reduce plaques and gingivitis. It is used for fresh breath and prevent dental caries. Some common ingredients of this mouthwash is alcohol, act as a solvent and antiseptic, flavoring agent, coloring agent and preservative. So these are all the preparations containing antiseptic, example chlorhexidine, Fluorides, example, sodium fluorides. Cosmetics is example, essential oils. And therapeutics is a benzdiamine. Benzdiamine. And which of the following mouthwashes is primarily used for its antiseptic action? So option C, chlorhexidine. The role of alcohol in mouthwash formulation is mainly to act as option C, solvent and antiseptic. So next is the dental product. So dentifrices, calcium carbonate. So it is act as a mild abrasive, and synonym of this calcium carbonate is precipitated chalk and whitening. So mainly it acts as the abrasive in the toothpaste. Assayed by complexometric method. Sodium fluoride. So fluorides of sodium is a fluoride source, and here converts hydroxyapatite to fluoroapatite and inhibit the bacterial acids productions and promote demineralization and prevention the treatment of dental caries, and it's assayed by non-aqueous titration. Strontium chloride is it is reduce the sensitivity and nerves transmissions, occludes dentinal tubules and reduces nerve transmissions, and acts as a desensitizing agent. It's assayed by argentometric titrations. And zinc oxides and eugenol, it is type of dental cement. So eugenol chelate zinc oxide to produce zinc eugenolate. So it's a matrix and it is a sedative and antibacterial effect, and it is used temporary dental filling and cavity based impression paste. This is used for the dental filling. It acts as the dental cement, and it is assayed by complexometric method, zinc oxide. The synonym fluoride of sodium is refers to, so option C, sodium fluoride. Which of the following synonym of calcium carbonate is used in dentifrice? So option B, whitening. Which dental product acts by converting hydroxyapatite into fluoroapatite? So option B, sodium fluorides. Occlusion of dentinal tubules with reduction in nerve transmission is the mechanism of option C, strontium chloride. Which dental product is mainly used as an abrasive in toothpaste and tooth powders? So option B, calcium carbonate. Zinc oxide eugenol cement is mainly used as, so answer in the comment box. So thank you. Join in our WhatsApp community. Thank you. Like, subscribe and share.